I'm Dr. Premitha Damodaran. I'm a consultant, gynecologist, menopause and women's health specialist. Unfortunately, women are worried about HRT. That was a story that was all read wrong. So it started about 25 years ago. There was this huge study from the US where they put women between the ages of 50 to 80 and they put them all on HRT. And what happened 5 to 6 years later, they found that HRT equals a higher risk of heart disease, equals a higher risk of breast cancer. And that study all was stopped. And that fear went around the world. We looked at that study a little bit more. And then they divided that 50 to 80-year-olds into 3 groups. They found that those women who were on HRT between 50 to 60, their heart disease was so much lesser. They were actually healthier. So that's what we know today, that if a woman wants to go on HRT, we start her earlier when she is in the perimenopause or within 10 years of menopause. There are many kits sold in the market now which actually are said to be able to diagnose perimenopause and menopause. What are they actually checking? They are actually checking 2 hormones. One of it is the follicular stimulating hormone and the other is the estrogen levels, which goes by estradiol. Unfortunately, these kits are laboratory tests. And to diagnose menopause, we shouldn't be looking at lab tests. We should be actually listening to her. It's a clinical diagnosis. So we need to look at what her symptoms are, what her periods are, and then come to that conclusion rather than looking at what the results of these tests are. I think the most important thing is to listen, to empathize, and to understand what she's going through. A lot of women at this stage in their lives are going through so much. They are not the person that they used to be. The hormonal swings are causing them not to sleep. At the same time, they have life stresses going on around them. So our role is actually to try and help her through this. And then we talk about supplements. We look at her blood test results. And then we talk to her about hormone replacement therapy if she actually needs it. So this would be the way for us to look after that woman, because we're not looking at just that woman at that time. We are now looking at how do we keep that woman healthy for the next half of her life, because we are talking 30, 40 years of her life and making sure that she has that quality of life.